We are the psychiatric nurses. I'm Allie.
I'm Alex.
I'm Sarah.
Mom.
Logan.
I'm Faith.
I'm Riley.
Emily is a 19-year-old patient who was brought to the hospital by her parents and voluntarily admitted herself. Her parents said, "This is our last stop. She's a grown woman, and she will have to figure this out on her own from now on. Don't call us." Emily has now been inpatient for 24 hours, and this is our first shift working with her. When we enter the room, we notice that last night's dinner tray is still there, untouched. When we bring her morning medications for bipolar disorder and a glucometer to check her blood sugar level, she refuses. She states, "I do not need them. The doctors say I do, but I don't. The medications just leave me not feeling anything. I'm sick and tired of my fingers being stuck. Don't come near me." After 30 minutes of discussion, she still refuses meds and states that she is ready to be discharged. She just doesn't want to be here anymore.
According to the Code of Ethics for Nurses with Interpretive Statements, fundamentally, ethics is a theoretical and reflective domain of human knowledge that addresses issues and questions about morality and human choices, actions, character, and ends.
Okay, so we're going to go over just a few of the options. First, we're going to go over the illegal options. The first one would be forcing her to take the medicine without her knowledge. The second one would be lying about the medication. The third one would be sending her home without a doctor's consult. Now for the legal options. First, you can ask your supervisor or ethics committee for help or advice. Second, you can take no action and have another nurse deal with it. Third, the patient can leave AMA, which means against medical advice. And fourth, the nurse can explain the medication and try and convince Emily to take it.
And these are some of the legalities. Patient must have sufficient information about his or her medical condition. Patient must understand the risks and benefits of the available options, including the option not to act. A patient must also have the ability to make a decision with keeping his or her personal values. And there's some more. Patient must be able to communicate with his or her decision, and patient must have the freedom of will to act with undue influences from other parties such as family and friends. And then patient must have the mental capacity to make decisions.
Here are some scriptural references that you could use to help her or yourself through this difficult time. The first one is Proverbs 15:1, which is, "A soft answer turns away wrath, but a harsh word stirs up anger." The second one is Luke 9:23. "Then he said to them all, 'Whoever wants to be my disciple must deny themselves daily and take up their cross and follow me.'" And the third one is Zephaniah 3:17. "The Lord your God is with you, the mighty warrior who saves. He will take great delight in you. In his love, he will no longer rebuke you, but will rejoice over you with singing."
Here are some of our solutions. Make sure Emily or the patient feels validated and not threatened. You should encourage her, inform the patient about their illness, treatment, and consequences, and be willing to listen to her concerns and her wants.
Could also offer to pray with her or just have a conversation with her. Perform a screening test to determine whether or not she is mentally competent. If she has trouble taking oral medication, you could offer to give it to her in another form, like crushed or through food. And then consult with the pharmacist to discuss different medications or see if they can be administered at a different time since Emily was feeling lethargic. And that's our presentation. We also have a video that kind of just recaps everything that we just said.
Emily is a 19-year-old patient who was brought to the hospital by her parents and voluntarily admitted herself. Her parents said, "This is our last stop. She's a grown woman and she will have to deal with this on her own from now on. Don't call us." Emily has now been inpatient for 24 hours, and this is our first shift working with her. When we enter the room, we notice that last night's dinner tray is still there, untouched. When we bring her morning medications for bipolar disorder and a glucometer to check her blood sugar level, she refuses. She states, "I do not need them. The doctors say I do, but I don't. The medications just leave me not feeling anything. I'm sick and tired of my fingers being stuck. Don't come near me." After 30 minutes of discussion, she still refuses medication and wants to be discharged. She just doesn't want to be here anymore. What do we do? These are our legal options.
Hi, it's your nurse. This is the medicine you should take. It's called ibuprofen. If you take it, you'll feel better.
These are our illegal options.
Hey, leave.
Okay.
The patient must have sufficient information about his or her medical condition, and they must understand both the risks and benefits of all available options, including the option not to act. The patient must also have the ability to make a decision in keeping with his or her personal values. The patient must be able to communicate his or her decision, and have freedom of will to act without undue influences from other parties such as family and friends. Lastly, the patient must have the mental competence or capacity to make a decision for themselves, which can be determined through a screening test.
Proverbs 15:1. A gentle answer turns away anger, but a harsh word stirs up wrath. Luke 9:23. Then he said to them all, "If anyone wants to follow after me, let him deny himself, take up his cross daily, and follow me." The Lord your God is among you, a warrior who saves. He will rejoice over you with gladness. He will be quiet in his love. He will delight in you with singing.